How you doing? My name is Dr. Muhammad Ali, and I'm the Associate Program Director of the One Brooklyn Health Physical Medicine and Rehabilitation Program here in New York City. Today we're going to discuss some very brief topics for patient education purposes regarding the cervical spine, otherwise commonly referred to as the neck. Just some basic complaints, questions we get in the clinic, and just a brief overview of the anatomy and some of the diagnostic imaging and other methods that we use. So first, we're going to start with basically what could happen. Patients usually come to us after they've seen some other specialists, variety of specialists, including a neurologist, sometimes for the headache complaints, or they've already been through acupuncture, physical therapy, chiropractic manipulation, and they end up still not really improving, so they end up coming to us for further management and treatment and kind of just asking us what's wrong. So very commonly, we end up having patients that may have headaches, especially in the back of the head, posterior, which are resemble migraines, and shoulder pain, which would be somewhere in the shoulder here or further down, maybe on the outside of the arm or all the way down the arm. Numbness and tingling, etc., could be accompanying that. And then again, some of the brief anatomy we're going to discuss: the intervertebral discs, which are between the bones in the neck, and the facet joints, which are joints between the bones, just like in your finger. And we'll kind of show you and kind of go through that very briefly. The diagnostic modalities that we use would be X-ray, MRI, and electromyography and nerve conduction studies, which are kind of specific to our field, and it gives you a functional physiologic evaluation of the nervous system. Regenerative medicine we're going to touch on very briefly, just platelet-rich plasma, commonly referred to as PRP. A lot of people have heard about this before. It's where you just take the blood, you kind of spin it down, and then you use it in various parts of the body to heal and help with pain control. Athletes have been using this for years. And bone marrow aspirate stem cells, which are effectively from your body. So it's your body's cells, and we utilize that to, again, treat different parts of the soft tissue or otherwise areas that are injured within the body. So we're going to use this modeling software here. So as you can see, this is the cervical spine. There's 7 bones in the neck. We're going to rotate this around just so you can see very, very quickly here. All right. So these are the discs between the bones in the neck, and these are what we were referring to as the intervertebral discs. They can end up getting damaged, brittle over time. That gelatinous, watery substance inside them that allows them to be nice and squishy and absorb impact might tend to get brittle. You might tend to have some issues on the outer rim, and then you might end up having a herniation, and that could end up causing you some problems. If we kind of put the nerves here, you can see that you might have, if this does end up coming out into the spinal canal, it could press on these nerves and end up causing pain that might shoot all the way down the arm or into the shoulder, just depending on the level and the area where it's touching the nerve. So that's one form of complaint that we might get. And again, this could usually be accompanied by numbness, tingling somewhere in the shoulder or arm, and that could be one type of problem. As we kind of rotate around here, I'm going to zoom out, just bear with me. So now, if we come and look at the back of the neck here between the bones, you can see there's a very small joint, and this is actually a synovial joint, which means it's fluid-filled and cartilage-lined. The fluid in here should be low viscosity and allow everything to glide, just like your fingers, where your digits and your fingers bend. And effectively over time, the arthritic changes and the lack of fluidity there might end up causing some pain. And that can also refer to the shoulder, can refer down into the arm. It might be a little different than the pain from the nerve being touched by a disc, but again, this has to be diagnosed by a thorough history and physical exam, as well as diagnostic imaging and electromyography and all of these things that we do in the clinic to kind of determine what could be wrong with the patient. So that's generally what the common 2 complaints are, or the 2 primary pain generators. But just so you understand, just for clarity here, you might end up having also pain besides the shoulder, the arm, the hand, or all the way down into the arm from the neck. You can have other problems. So we're going to add one more layer of nerves here. So you can see these nerves that come up the back of the skull. So these come directly from the neck, and you can kind of see that. The smaller nerves which innervate these joints here, which may cause pain, they're not depicted in this anatomical model. They're very tiny, and they're very rarely in any kind of anatomical modeling. But here you can see these nerves may radiate up into the back of the head, and if they do, they might cause pain that resembles a migraine. So oftentimes patients might end up at a neurologist's office and might have Botox and a variety of other treatments and oral medications, and they don't work. And then they end up coming to us and they just again ask, it's been years, I've been in pain, how can I fix this? And again, we would use a thorough history physical exam and any diagnostic imaging we have available to us to determine what would be wrong with the patient and how to kind of improve on that. So just very briefly, regenerative medicine can be used if standard treatment methods don't work. Regenerative medicine is typically not covered by insurance at this point, although the studies are fairly promising and patients do often seek out treatment. PRP and bone marrow aspirate stem cells by name, they come to our clinic and ask us for this. So we go through everything, and of course we tell them that there's no guarantees, but if they've already tried and exhausted every other treatment method, then it's definitely reasonable to try this to see if they can kind of get themselves out of pain, because obviously, living in pain is not comfortable, and there's no reason people should suffer. So again, this is kind of just a very brief overview of the common complaints that we do get in the clinic. You really should have a thorough evaluation by a trained clinician. If you're referred to a physiatrist, which is a physical medicine and rehabilitation doctor from another specialty, then they obviously are trying to figure out what's wrong. They refer patients to us to kind of go through everything and help them with their patients. And again, acupuncture, chiropractic manipulation, physical therapy, these are all wonderful ways to kind of start. But if all of that fails, then you end up seeing a specialist like us, and we can utilize a variety of treatment methods and diagnostic methods to kind of help out with that. So again, just very briefly, just for patient education, this video was very short, and we'll have some longer videos later to go through all the regenerative medicine treatments and all the standard treatments in detail to kind of explain everything that we do. But just for patient education, just to know that if you have pain in your shoulder, it could be from the shoulder, it could be from the neck. It's hard to tell, and of course, if you just go to a general doctor, it's not really something that they are trained to go through, and they don't do electromyography, for instance, and they don't always review MRIs, and it's just very difficult for them to determine what's wrong. So it's always good to see a specialist and kind of figure out what could be wrong. All right, so we'll go through some other videos later, but again, this was just a brief overview of the cervical spine, neck anatomy, some common complaints that you might have, and some very brief overview of the anatomy itself, including the intervertebral discs and the facet joints and some headache syndromes that you might have from a variety of these degenerative changes over time. All right, and again, my name is Dr. Muhammad Ali. We'll see you soon.